Thanks a lot, Mr. President. You've mentioned, other members of your task force have mentioned, over the course of the next 2 weeks, it's going to be a very difficult time for our country in terms of fatalities. And
it will be a difficult week and a half.
And there are a number of governors who are close allies of yours, Mr. President, who have refrained thus far to have these stay-at-home orders. And Dr. Fauci, who of course is on your task force, has said that the states that don't have stay-at-home orders are putting themselves at risk and the country
Well,
at risk.
if Dr. Fauci said that, I would be inclined to call them up. You know, we do have a constitutional problem in doing that. You understand that. I mean, there's a double-edged sword. You understand. I can do it, but it is a constitutional. You can say federalist. You can say there's lots of different reasons where I would rather have the governors do it, make their own determination. They're smaller, and not in all cases, but sort of they're smaller cases. But I'm not sure 100% that Dr. Fauci said that, but you can ask him. Tony, you want to say something, please?
So I had good conversations with the governor of Nebraska and the governor of Iowa here, and it's interesting that functionally, even though they have not given a strict stay-at-home, what they are doing is really functionally equivalent to that. And we had a really good conversation with both of the governors, and when I had mentioned that, I think there was a public response that they weren't really doing anything at all, and they really are doing a very good job, both of them. Those are the only two that I spoke to, but it was a really good conversation, and I want to make sure people understand that just because they don't have a very strict stay-at-home order, they have in place a lot of things that are totally compatible with what everyone else is doing.
If I could ask a question, Dr. Fauci, before you...
Go ahead.
About getting back to normal, you said you wanted to get back to normal as soon as possible. Will we truly get back to normal in this country before there's an actual vaccine that's available to everybody? How do you start lifting the restrictions safely?
Yeah, well, John, if back to normal means acting like there never was a coronavirus problem, I don't think that's going to happen until we do have a situation where you can completely protect the population. But when we say getting back to normal, we mean something very different from what we're going through right now. Because right now we are in a very intense mitigation. When we get back to normal, we will go back gradually to the point where we can function as a society. But you're absolutely right. I mean, if you want to get to pre-coronavirus, you know, that might not ever happen in the sense of the fact that the threat is there. But I believe with the therapies that will be coming online and with the fact that I feel confident that over a period of time we will get a good vaccine, that we will never have to get back to where we are right back now. So if that means getting back to normal, then we'll get back to normal.
I think that...
May I ask Dr. Birx to clarify something that she said on Saturday? If I may, Dr. Birx, this is a question that comes from a radio colleague of mine, Tamara Keith. And on Saturday, it sounded like you said that for the next week, people in high-risk areas should not even go to the market or the drugstore. Is that what you meant to say, or is that accurate?
You know, out of respect for every single healthcare worker that's on the front line, whether they're a nurse, a doctor, a respiratory therapist, the phlebotomist, the persons who come in the rooms to clean, you know, out of respect for them, we as Americans should be doing everything possible. And what I meant was, if you can consolidate, if you can send one person, the entire family doesn't need to go out on these occasions. We really need, this is a highly transmittable virus. We've been saying that we want every American to know that what they're doing is making a difference, but we need to have solidarity of commitment from everyone to really, so, you know, maybe once every 2 weeks we can do a grocery store and pharmacy shop for the entire family. So it was really about, we have to do everything we can. I know I see on the TV stations the level of human suffering in the hospitals. Dr. Fauci and I and Admiral Giroir have spent our lives taking care of others. We need to take care of each other now as Americans and do everything that's in those guidelines. And I know they're tough. I know incredibly how tough they are. My grandchild of 10 months got a fever of 105 this weekend. I'm the doctor, and I couldn't get there. I mean, so I'm trying to explain to my daughter how to listen to her lungs, how to listen to her lungs
So you
and then the
did not
baby's
get there.
lungs.
You did not get there?
I did not go there.
Good, I'm very happy with that.
Because of you two. I mean, when you can't take that kind of risk with the leaders of the country.
Your grandson's
So,
okay?
daughter, but she's
That's a
coming
lot
out
of
of it.
temperature, 105.
Yes. But, you know, we're all, and that's just an illustration that I know you all are making sacrifices, and I guess I want everyone to take this seriously. So that was really a call of seriousness of how important this is and how we're starting to see the impact, but you can see what can happen when you come at this a little bit too late. And that's why the message, before you see it, before you have to see your hospitals and your emergency rooms overwhelmed, it is on us as a member of this community, of this country, to do everything possible to save one another. And so that was really what I was saying, and I will continue to say that, because I do believe it's making a difference. You can start to see it making a difference, but we have to do even more right now, because that will predict where we are 2 or 3 weeks from now. Thank you, Mr. Vice President. I think you heard very clearly our concern in the New York, New Jersey metro areas. This also includes Connecticut and Long Island. As we talked about, we did see a significant increase in Sussex County over the weekend. The weekend numbers are always difficult. I want to be clear on that because sometimes case reporting is not as accurate over the weekend. So we'll be watching very closely today's numbers and Tuesday's numbers. We're also very, of course, focused on the New Orleans metro area, and that includes the 3 parishes of Jefferson, St. John's the Baptist, and New Orleans proper, and of course the Detroit area, which is Oakland and Wayne. As we mentioned before, we're continuing to track very closely out of concerns of it potentially reaching logarithmic phase in the Chicago metro area, the Boston metro area, the DC and Baltimore metro area, Indianapolis, the Denver area, and 2 regions of Pennsylvania, Philadelphia and the Pittsburgh area, as well as Dallas and Houston in the Texas area. I had a very encouraging call because we also don't want to miss anything. Remember, I showed you a lot of states were very much under 25 and 50 cases per 100,000. There were a few standouts that we were concerned about, which was Vermont, New Hampshire, Idaho, and Montana. We had excellent calls today with their health commissioners, and they're they're on top of the situation. These were micro outbreaks that occurred due to ski events and weddings and nursing homes, and they were able to describe in critical detail the incidents and how they're tracking and tracing. So they are still doing full contact tracing through those areas, and I just want to applaud both a rural and metro problem, and I really want to applaud how many of the states that may have smaller populations are approaching this. That gives us encouragement of how we can talk about beginning surveillance activities at the same time we're following these very clear outbreaks and ensuring that there's full supplies based on the very granular data that we're utilizing. And I just want to thank the mayors and governors who get us that granular data and allows us to make these deep interpretations across all of the United States. We know each governor is concerned about their areas, but these metro areas cover different areas. So the Philadelphia area also includes southern New Jersey and Delaware, and so we have to really look at things very much as both the metro and the communities that surround those metros. And so all of those people, we ask you again throughout the United States to follow these very clear guidance. I want to just recognize both HHS, and you heard about the work that Admiral Giroir is doing, the work that Dr. Hahn and Administrator Seema Verma are doing, and also Administrator Engels in the work of HRSA to really ensure that our federally funded clinics are actively engaged in all of these aspects. But I also want to recognize the military, the medical corps, the nursing corps, and the medical subspecialty corps. These were my brothers and sisters for 29 years. It is highly unusual for the active force to be called into a domestic situation. I think that shows you how seriously we're taking this at the federal government level. In my 29 years in the military, I was never deployed domestically. So this is showing you how serious of an event we take this. If the military is deploying domestically, it is another reason for every American to be following these guidelines. Finally, CDC quietly launched a new website. It's if you go to cdc.gov and you go to COVID-19, you can find their surveillance data. This surveillance data is bringing together our influenza-like illnesses with their syndromic management databases so that you can track the respiratory disease across the United States. The states are used to using this system. It's in emergency rooms, it's in hospitals, it's in doctors' offices, and it gives you insight, and you can see very clearly influenza A peak. You can see the influenza B peak, and now you can start to see the respiratory disease from this current outbreak. These are the systems that exist within the United States that will be strengthened in order for us to do comprehensive surveillance. So I just want to assure the American people, while we're working on these outbreaks, we're also working on bringing new systems together that have a comprehensive look across the country, building on the strong work of CDC as a public health institution, so that we can work county by county, community by community, state by state, to really understand where this virus is and where it will be, but also as an early alert for us in the future. So I just want to assure the American people that as we're working on the crisis of today, we're looking to the future to ensure we have the systems in place to bring those early alert systems together while we work on the antibody testing and while we work on continuing spreading and increasing the diagnostic capabilities that you see presented here.
Dr. Fauci, your thoughts, and then we'll take some questions.
Okay, I just wanted to, okay, I will. It related to something I said yesterday about that somewhat paradox of everything going up at the same time that the feeding into this engine of this virus is starting to show some signs. So Governor Cuomo today reported an interesting data from New York, namely that the number of hospitalizations, the number of admissions to intensive care, and the number of requirements for intubations over the last 3 days have actually started to level off. So again, everybody who knows me knows I'm very conservative about making projections, but those are the kind of good signs that you look for. You never even begin to think about claiming victory prematurely, but that's the first thing you see when you start to see the turnaround. That doesn't mean we don't have a lot of work to do. That tells me, instead of saying, that's pretty good, it's we got there through mitigation. We cut off the stream of people who ultimately required hospitalization, required intubation, required all of the kinds of extreme methods. So we just got to realize that this is an indication, despite all the suffering and the death that has occurred, that what we have been doing has been working. So the call that I say every time I get to this podium is just keep it up, because this is going to get us out of it. This is our best and only great public health tool.
And are we starting to see that across many states? We're seeing the level of hospitalizations and deaths is lower than what we anticipated.
Well, you're going to see it most dramatically, John, in a place like New York, where you see it goes up and peak, and then it will hopefully, and I think it will, come down. When you have places like Seattle, which and Washington State, who did a really good job from the beginning, it never really did that. So they were able to keep it down. And on the charts that Dr. Birx showed, when you saw California and Washington State, they were fortunate, they did a good job, that it never really got out of hand. So again, this is a big country, and you have a number of different metropolitan areas. I think if we do it right, you're going to see those who have not peaked will not peak, and those who have peaked, the New Orleans, the New York, New Jersey, Chicago, Detroit, and others, you're going to see the same thing if we keep our foot on the accelerator.
Further questions for the team?
Yes, sir. I'm just following up Dr. Fauci's comment earlier about what it's like going to be coming back to normal, and until there's a vaccine, that there'll be gradual steps towards restoring normalcy. Under that, short of a vaccine, does putting 80,000 people, fans, spectators in a sports stadium, or 25,000 politicos in an arena for a political convention this summer make a lot of sense? Or does those sorts of things require a vaccine to fully protect the American populace?
I don't think that you're going to have to say that the country cannot get back to a real degree of normalcy until you absolutely have a safe and effective vaccine. It will be really evaluating the kinds of things, and that's the reason why it was discussed up here, why it's so important to have an antibody test so you know what the penetrance is in society. And then we have a situation where we don't ever want to get to have to mitigate. We want it to be able to contain. And by the time we have to face what's going to happen with this going back to normality, we will have in place the capability of identifying, isolating, contact tracing, so that it never gets out of hand. Ultimately, the showstopper will be obviously a vaccine where you can vaccinate people and you won't have it. There's going to be another issue that's going to be important, and it has to do with somewhat of a comparison, for example, with influenza. We go through multiple cycles of influenza. There's always a degree of background immunity in the population. I mean, that will ultimately happen if we get a situation where we get back to normal. Now, I hope we don't have so many people infected that we actually have that herd immunity, but I think it would have to be different than it is right now. So again, remember when you say normalcy, I mean, we could get back normally, economically and otherwise, without necessarily saying we're going to forget about the virus. We have to pay attention to this because we've had a very bad experience with this virus.
Dr. Fauci, can I follow up on that, please?
Thank you, and this is for the Vice President, for Dr. Birx and Dr. Fauci, but can you give us a sense of, and I know you don't want to make any projections, but where we are with the numbers, because we saw that horrible number today, more than 10,000 deaths now in the U.S. Are we on track for those best case scenario numbers that you had laid out, the 100,000? Or are we potentially coming in lower than that at this point, given some of what you're seeing?
It just gives me an opportunity to thank and respect the modelers who have really worked on this, because there's a large number of them have worked very hard and done a lot of predictions. And what we did is we did predictions of predictions. We like to integrate data, and so that's where you come up with these numbers. I think Dr. Fauci and I both strongly believe that if we work as hard as we can over the next several weeks, that we will see potential to go under the numbers that were predicted by the models. And I think that is really two things. It is the extraordinary compliance of the American people and the diligence that they have mitigated with. Because remember, we are doing this strictly by behavior change. It's very hard to change trajectory of viruses on just behavior change. We have had difficulty in our past doing that. So that's what we're doing, and that's what the American people are doing. But the other side of that is the incredible insights that Washington State and others are providing on how to better care for the patients in the hospital. And so those two pieces are coming together that could have a dramatic impact on the predictions of the mortality from this disease.
So I'm glad you asked that question, because I've said it a couple of times here. I want to say it again. Repetition is good. Is that models are good. They help us to make projections. But as you get data in, you modify your model. And I've always said, data always trumps models, always. So what I feel, and I believe that Dr. Birx also feels, that I don't think anyone has ever mitigated the way I'm seeing people mitigate right now. This has never happened in this country before. So I am optimistic, always cautiously optimistic, that if we do what I've been talking about over the past few minutes, we can make that number go down. I don't accept every day that we're going to have 100 to 200,000 deaths. I think we can really bring that down, no matter what a model says, because when the data comes in, they'll start to say, maybe you are essentially overshooting the model. And I think that's where we can go. That's the reason why I like to always get up and tell the American people, it's the virus doing what the virus wants to do, and it's we as a society doing what we can do.
And let me just amplify that from a layperson's perspective. And the American people are doing it. I mean, the initial data, what we've seen in California and Washington, support the fact that the American people are doing these things, which is nothing short of loving your neighbor. I mean, the truth is, the threat of serious illness for most Americans is relatively low. But the threat of serious illness for seniors with underlying health conditions or anyone with an immunodeficiency is very high. And when we see Americans putting these principles into practice the way you all have been, it really means you're considering others more important than yourself. And I have to tell you, for the president, for me, for all of us, it's deeply inspiring. We just need to continue to do it for all of these 30 days, and we'll bring that number down. How about a couple more, please?
So, Mr. Vice President, when will you know, when do you think that you will know whether or not you will have to extend those 30-day guidelines, or if 30 days will be enough?
Well, the experts told us that somewhere around the middle of this month would be the peak. And as we begin to see a couple of days, that might be the beginning of leveling, we're gonna watch that carefully, and we're gonna bring that information to the president. But for now, the decision is, and the request of every American, is to continue to put into practice all of the president's coronavirus guidelines, 30 days to slow the spread. And for all of you in areas that have been impacted broadly by the coronavirus, listen to what your state and local authorities are asking you to do. It will protect your health, your family's health, and it will save lives. Let's do a couple more, and for our panel, if you'd like. Jeff.
More of a personal question, but Dr. Birx, can you tell us if your granddaughter's okay? And
Yeah, I'd like to know too.
Well, thank you. Due to the great care of my 91-year-old nurse mother and my daughter, she's down to like 100 to 99 now, but it was 3 days of 104 and 105, which is, babies can do that, but it's very scary, especially when I couldn't assure myself that she was fine. So it was just some sleepless nights for me and them as they kept her fever down. So thank you for asking.
do you have the virus?
Oh,
or?
no, I'm sure it's roseola or something. They have not been out of the house. They're not allowed out of the house. They've got 2 granddaughters under 1, 2.5 almost, and 1 only 10 months, and my 91-year-old and 96-year-old. So no one is allowed in that house or out of that house because there's too much precious cargo inside the house.
怎么又晚了？
这诊所太远了，这里多开几间就好了。
政府里需要有我们的人，需求才会被听到。
哎，你这……哎，你们两个都对，可光说有什么用啊？填好2020年的人口普查，就可以协助公共资金的分配，比如地方医疗、更多的政府席位。想要给自己发声啊，赶紧上网填，打电话也行。
请上2020census.gov 完成普查。